Hello, my name is Ariana Moretta, and this is my presentation for Christian ethics taught by Pastor Reginald Horton. And today, the topic that I'm going to be talking about is physician-assisted suicide in the cases of mental illness. To begin this presentation, I'm going to give a brief overview of what physician-assisted suicide is. According to Cornell Law, the definition of physician-assisted suicide is when a patient performs a life-ending act with the assistance of a physician. Now, why is it that people would want assisted suicide? In what cases would they want to end their lives with the help of someone else? There are many different reasons why a person might want to go through with assisted suicide. Some of these reasons could include terminal illness, physical pain, emotional pain, not being able to enjoy life or activities that they used to enjoy, and also not wanting to be a burden on their families. Most of the time, cases of assisted suicide are seen in those who have terminal illnesses. The question that I will be bringing up in this presentation is, should mental health be considered a terminal illness? And if you consider it a terminal illness, is it grounds for physician-assisted suicide? As physician-assisted suicide starts to become more popular, we're seeing some countries that allow people with mental illness to opt for assisted suicide. Should mental illness hold the same weight as a terminal illness, and should we be allowed to assist people in ending their lives for the struggle of mental illness? When looking at the ethics of this particular topic, there are a few things that I want to look at and consider. The first thing is how does this affect the decisions of mentally ill people? Do mentally ill people even have the decision-making capabilities to decide if they would like to opt for physician-assisted suicide? The other thing that I would like to consider is what happens if this option begins to expand to more groups of people other than those who are suffering from terminal illnesses and mental illnesses. The last thing that I want to explore is the possibility of a person being pressured to give up their life when there is still hope for them, before their time and before they need to. How does this option affect people dealing with mental illness? The criteria is that the person must suffer from a grievous illness and that the illness must also be irredeemable, meaning they cannot come back from it. But when looking at a person with mental illness, how can we just look at them and decide that they are irredeemable? If you go into a physician or a psychiatrist looking for help, and they recommend that you end your life because to them, you may seem irredeemable at first glance, that could immediately take away all hope of someone who is looking to get better. Instead, they are being told that their situation is so severe that they might as well just end their lives. We need to look very carefully at the decision-making capabilities of a person with mental illness. It's hard to tell if a person genuinely wants to die, or is this simply a symptom of the mental illness? When looking at most people who are not struggling with mental illness or terminal illness or suffering through some horrific things, most people just don't want to die. So, how do you know that a person coming to a physician asking to die genuinely wants that, or is that simply a symptom of their mental illness? I have a quote here, and it says that assessing capacity is complicated by the fact that the desire for death is a symptom of many mental disorders. As I mentioned before, most people not suffering from an illness do not have the desire to end their lives, so it is hard to know if this desire is genuine. I have another quote from Dr. Dina Miller in which she states, "Depression distorts cognition and leads many patients to believe that they would be better off dead and that their loved ones would be better off without them. However, as she said, This is a cognitive distortion, not reality, but it is something that people with mental illness believe, even though it is not true. And by giving them a decision to end their lives, it seems as if we would be reinforcing this distortion. When you look at a person struggling with mental illness and some mental disabilities, they often struggle to make simple day-to-day decisions. Ending your life is probably the biggest decision that they can make. How can they be tasked to make this decision if they can't even handle simple ones for themselves? If a person with depression struggles to have hope, like I mentioned before, they may choose this option because it is available, especially since people with depression tend to lack motivation and they can have a hard time reaching out and don't know where to go when they feel so overwhelmed. The next thing I want to talk about is assisted suicide being used for other groups of people. The more assisted suicide is seen as a solution to life's problems, whether it be physical or mental illness, the more we risk it being used as one for other issues. Other vulnerable groups of people that may become susceptible to this are homeless people and those with physical disabilities. Dr. John Mayer makes a compelling argument when talking about this topic. He begins by asking, how can we speak of autonomy to choose death when patients are not given viable support to choose life? Death is not an acceptable substitute for good treatment, food, housing, and compassion. In Canada, medical aid in dying has become legal for those struggling with mental illnesses, which means that it is much easier to access for somebody living in the U.S. A reader of Medscape in Canada said, I have seen a handful of people, including someone I considered a good friend, opt for medical assistance in dying because it was easier than living as a disabled person in poverty without adequate mental health care. This just shows us that resources need to be more readily available for people who are struggling, because if resources were more readily available, then people would not feel so much as if they were a burden, and like the easier option would simply be to die. Life for a homeless or a disabled person is much more difficult than somebody who is not disabled or homeless can ever imagine. What would stop a homeless or a disabled person from claiming mental illness? We are giving that option, and they may simply believe that it is easier to die than keep living in the conditions that they are currently living in. And we would be giving them that choice. Not only would we be giving them that choice, but we would be helping them make it. The last aspect I want to bring up is unneeded pressure. In the Netherlands, where physician-assisted dying is already legal, some physicians will advocate and advise euthanasia even when the patient is not terminally ill. If this is already happening in other countries, what is stopping doctors from our country or any other country that this may become legal in from applying the same pressure to their patients? A person who struggles with mental illness, who may already believe that they are worthless or not worthy of being alive, may face unneeded pressure from friends or family who are tired of caring for them. They may believe, or they may be told even, that it would be easier for everyone if they were no longer living and if they were no longer causing stress and strain to those around them. On the flip side, there is the argument asking if it is ethical to force someone to keep living. We are all born with autonomy, but how could it be ethical to watch someone that could have been helped end their lives because of circumstances that could change and illnesses that could be treated? A person that wants to die can end their own lives, and we cannot stop them. But how can we sit there, see them struggling, see them dealing with distortions and beliefs that we know are not true, and not do anything to help them? Not only not do anything to help them, but aid them in dying. That is unethical. There are many different solutions that we can consider in order to help people struggling so that they do not feel the need to end their lives. The first and most obvious and most important would be better mental health care. In Canada, there is a 5-year wait list for mental health care in some places. Another thing that is extremely important is mental health education. People need to know the signs and symptoms of someone who is struggling, even if that is themselves, so that they can reach out for help, both for themselves and for those around them. It's also important to end the stigma around mental health and the belief that people who struggle are crazy or that there is something seriously wrong with them that cannot be helped. We also need to take people who are struggling very seriously. We cannot ignore them when we know that there is something going on. We can also incorporate different forms of therapy. I know that not everyone believes in therapy, especially talk therapy, but there are many different forms of therapy. There is art therapy, dance therapy, poetry therapy, horse therapy, all different types that are helpful for different groups of people. And if they were given more options and more opportunities, it could help them in ways that the traditional way of going about things couldn't. Thank you so much for listening to my presentation. I hope this brought a new issue to your attention or just opened up a different perspective to think about when talking about this subject.